The Plum 360 has many safety features in place to ensure appropriate infusions are administered to our patients. One of these features is the dose limit. There are two types of dose limits of these pumps, soft limits and hard limits. This video will describe the difference between the two and how you should respond if you find yourself programming outside of these limits. When you use the drug library to choose a medication, you are doing more than just labeling the drug that you will be infusing. Each medication entry in the drug library is programmed with the specifics of each med. You will notice the information required to be entered for each drug may change based on how that medication is measured. Some medications are weight-based, and you will need to enter the patient's weight. Some are measured in milliliters per hour, others milliliters per minute, or sometimes micrograms per minute. So remember to always pay attention to the units of measure when entering your program. Each drug is also programmed with the safe ranges for administration. This is where the hard and soft dose limits will come into play. We'll look at cardizem. This is a medication that nursing can titrate from 5 mg per hour up to 15 mg per hour for most patients. If we attempt to program 20 mg per hour, we are presented with an alert on the screen that says this dose is greater than the 15 mg per hour soft limit. But it then gives us the choice to override this limit and continue to administer. Before you say yes, review your program and your order in the MAR. If you did intend this to be the rate, then choose yes, and the program will run. This soft limit exists to make sure that the person programming the pump is intentionally choosing a rate that is outside the normal range, but it's not yet considered unsafe. If we try to program the cardizem at a rate of 25 mg per hour, we will be told that the max hard limit dose is 20 mg per hour, and our attempted 25 mg per hour dose will be replaced with 3 dashes. We won't be able to input any new dosage into this pump until we push the yellow C or clear button. The hard limit stops us from being able to program above that dose. For cardizem, anything above 20 mg per hour is considered inappropriate and unsafe, so there is no way we can program above that rate. But let's say I truly meant to input a rate of 15, and I accidentally typed 25. Thanks to this hard limit, I did not accidentally overdose this patient with medication, and now I can enter the 15 mg per hour dose. That is why the hard limit exists, and also why it is important to always use the drug library when programming a medication infusion. It is there to help make medication programming easier for the nurse and to ensure the safety of our patients.